Well, hello, and welcome everyone. Welcome to the LSE for this online event, which forms part of this year's LSE Festival, Shaping the Post-COVID World. The LSE Festival is a week of virtual events which are free and open to all about the direction of the world that the world could and should potentially take after the COVID crisis. And we particularly focus on how social science research can shape that. For those Twitter users in the audience, the hashtag for today's event is hashtag LSE Festival. This online event is being recorded, and we hopefully will be making it available as a podcast, subject to no technical difficulties. My name is Justin Parkhurst. I'm an associate professor of global health policy in the LSE Department of Health Policy. I'm also currently the chair of the LSE's Global Health Initiative, and I'll be chairing today's event. And I'm very pleased in my role as chair to be welcoming three expert colleagues in health policy to the LSE today. Dr. Josep Figueras is the director and co-founder of the European Observatory on Health Systems and Policies. In addition to WHO, he has served major multilateral agencies such as the European Commission and the World Bank, and has worked as a policy advisor in more than 40 countries in the European region and beyond. Dr. Lucy Kanya is an assistant professorial research fellow at the LSE and is currently part of the LSE team working on the African Health Observatory Platform on Health Policies and Systems, or AHOP. Lucy has a health economics and policy background with experience working in sub-Saharan Africa and has previously worked on evaluation of health financing programs in Kenya and Uganda. And Dr. Matthias Wismar is program manager at the European Observatory on Health Systems and Policies. He is leading, managing, and developing studies in face-to-face dissemination and knowledge brokering events. Matthias has worked extensively on COVID-19 health systems responses and governance. Since October 2020, he has led weekly COVID-19 response webinars discussing a wide range of health systems responses to the pandemic. He holds a doctorate in political science from Goethe University in Frankfurt in Germany. But now I will hand over to Lucy, who will be moderating today's discussion. So over to you, Lucy.
Thank you very much for the introductions, Justin, and welcome again to all our participants. The COVID-19 pandemic has affected almost every area of our society, but perhaps none so dramatically as our health systems. The pandemic has tested many countries' health systems to and beyond their limits and highlighted the interdependence of health with other sectors at both the national and global levels. Today, we come together to reflect on what lessons can be learned from the pandemic response so far to develop more resilient health systems. What must be done to strengthen health systems to respond to a future threat of this kind? As of today, we have lost approximately 2.5 million people worldwide to the virus. And considering direct and indirect impacts of COVID-19, the full impact of this loss on the health systems is yet to be quantified. While we now have a number of vaccines that will hopefully allow us to move towards some sense of normality, these face myriad issues, including concerns around equitable distribution, financing, hesitancy, and the related infodemics. However, the pandemic has also been a catalyst for innovation, for collaboration and change in health service delivery. To help us reflect on the year that has been and what we can take into the post-COVID world, our panelists today will discuss the governance of health systems, communication, financing, and innovation. But before I bring them on, we would like the audience to participate in this poll, so please take a minute to reflect and respond. We will share the poll results thereafter. So the question is, what has been the most important challenge COVID-19 has posed to global health systems? Is it health systems governance, communication, health financing, or innovation? Thank you very much for participating in this poll. As usual, there will be a chance for you to put your questions to our speakers during this event. And instead of a traditional Q&A at the end, we'd be keen to hear from you throughout the event, so our speakers can react to your thoughts and questions in real time. Please use the Q&A feature at the bottom of your screen to join in the conversation. And please include your name and affiliation if possible. Now, I'd like to kick off the discussion between Josep and Matthias by asking you both to reflect on the challenges we have faced in the past year. So thinking about the COVID-19 pandemic, Josep and Matthias, if you were talking to yourself a year ago about the current state of the world, what would you say?
That's a tricky question to start, Lucy. That's a very tricky one. Actually, I've been thinking about that a bit. I've been thinking about what I would really say to myself. And I think there are two things I'd like to say to myself. There are two main lessons. Mm-hmm. And two main lessons that correspond to my two sides, basically. Our two sides, if I say so, Matthias, you and I. We are scientists, we communicate, we do knowledge brokering, that's what the Observer is about. So we are scientists on the one hand, and on the one hand, we do the research and we do the communication, the knowledge brokering. As a scientist, I think, I know what you agree, Matthias, it's humility. Humility. Mm-hmm. I do think I'm a humble man, but I think in spite of the enormous breakthroughs we had with science, with the new vaccines, treatments, the virus has really called our bluff in many areas. I think we have worked with a lot of uncertainty. We haven't really quite managed to put the right evidence in place, and particularly communicate that uncertainty well. So on my second side, I suppose, as a knowledge broker, it also is humility. Humility, because I never quite realized how much, although I'm a knowledge broker as well, how much the politics, the cognitive biases, the needs for the policymakers to make those important trade-offs between what is the evidence and the science and what it is, the values, what it is, other aspects apart from the interventions for the virus, aspects like in the economy, cultural values, the views about personal freedom and so on. So I never quite realized how important these elements would it be. So again, as a knowledge broker, humility would have been very important. And I think actually, let me stop about the humility, but just say the last bit on humility, which is the virus has really been an agent of humility for all of us. He really has called the bluff, has called the populists, the bluff of the populists. The virus doesn't pay attention to arrogant scientists, doesn't pay attention to spinning politicians. The virus keeps going on its own way. So I think that's been a good lesson for all of us. I hope we learn from it. Matthias.
Yes, I think the humility is pretty good, but I would like to add another aspect to it. I think that we need to think about the precautionary principle here, because yes, humility, I think this particular date a year ago was almost a turning point for many of us perceiving this large pandemic. The carnival was 2 weeks ago, 10 days ago, people were returning from their skiing holidays actually. And in hindsight, we know they have been participating in super spreader events in France and in Austria. And on these days, mushrooming out of a sudden were the infections, the reported infections. And a week later, actually, the dying started quite heavily in some of these countries. So we knew there is the infection. We cannot exclude it anymore from the continent. Actually, it's here. And what we knew from China, and other places, we knew it's going to be serious, but no idea how serious actually. No idea is it because we have a different context here in Europe, because we have different health systems, because we have universal health coverage almost across the whole continent? Will we react differently? Would it be the same? Even the genetic disposition may be different and play a role in this. So it was very difficult for me, and I think for many others, to predict what does it mean that the pandemic is now in Europe. And so I think humility is the right approach, because we need to be very cautious. But I think also, as soon as we see that there's something potentially really serious on the horizon, we have to be very cautious, and we need to take this serious. And I think we need to communicate this serious. And this, coming back to what you said earlier, to the communication and trust, I think we will go into more detail. So humility, yes, but also being precautionary.
Yeah. Well, thank you very much, both. And I agree with you. It's been a humbling experience for all of us. And as Josep rightly says, for scientists to actually come to a point where we say, we don't know. And even the leaders say, we don't know, we have no answers. That's been very humbling. And I think an opportunity for the whole world, for the globe to move together on this one. At this point, I would like to share the poll results.
Let's see what they can say with our vote, Matthias. What did we vote, Matthias?
We can go home now. It's all fixed, Joseph.
Exactly. Well done.
That kills my storyline.
Yes, yeah. We both voted governance. Well, he voted behalf of us because
for you.
We only have one mouse here, but yeah, we agree. We agree with that. Well done, the audience. They can continue. They can join. Yeah, that's good. Yeah. You have to comment on it, Lucy. What do you think? Are you surprised with it?
No, I'm not. I actually voted health systems governance as well. And because I know it's a very big issue. And actually, that's where I want us to start our discussion with. That's the topic I want us to start with this evening. So relating to the governance of health systems. So I think I'll start with Matthias. What have we learned in the past year on the governance of health systems that should inform decisions around strengthening health systems for the future?
I think three things. And the first one comes already with a poll that governance is super important in Europe, that governance really makes a difference. And I mean, we've been discussing why has Europe been hit so hard by the pandemic, despite, all the richness and all the advances and universal health coverage. And a lot of different theses have been discussed, like, for example, political system, geography, Ireland, and so on. And while there might be some truth in it, if you look across the whole European region of WHO, you have all sorts of political systems. You have islands, and it hasn't helped the islands actually much, I would say. I think it's really the governance if we look into Europe, and that's for me the first conclusion I would draw from this one. And that's something which we need to project into the future, that whatever we think about, will we have a new financing reform, we need to talk governance as well. If we have a health workforce reform, we need to talk governance as well. If we want to implement more equitable provision of services, better access, we need to talk the governance over. So that's the first one.
Isn't governance a bit of a buzzword, Matthias?
I do agree.
I always, you don't know what to say, and we say governance. I know you're a specialist in governance. That's why I dare to share, to challenge you. But governance, a solution for everything. But what do we mean by governance in the context of COVID?
I think we can look at it into two ways, and then it becomes very concrete. As an analytical perspective, asking, what are the key dimensions of governance? And then I would talk about issues such as transparency, accountability, participation, integrity, capacity. So when we want to analyze things, but if we want to talk about in very practical terms, what are the strategies actually to strengthen governance, then you come to quite detailed things. And one of the most important things, and there are plenty of strategies among things, I think, is the leadership and the decision-making. And we have seen this in many, many facets, that leadership and decision-making, effective decision-making, really makes a big, big difference, Joseph.
Yes, indeed. To me, actually, one of the aspects on this leadership, and I know it's a bit of we always talk about that, is this participative leadership. But in this case, it's been the case. When you look, it's been very much. If you look at New Zealand, you look at your own country, Matthias, your chancellor, this kind of humility in leadership, this kind of transparency in this leadership, this kind of participation of civil society, this kind of, the New Zealanders, for instance, do have a number of mechanisms to get civil society on board. The kind of human resources, it's important that we involve, it's so obvious that they have to be involved in decision making, but really they saved the day. They saved the day. It's not enough to go out and applaud them every day, and we stop applauding them, or should continue applauding them. Yeah. So to the doctors and the nurses and so on, how much we involve them in the process. Yeah. So part of that governance, isn't it, is how we bring them on board in that thing. But let me add one thing. To me, the key issue, what do you think about that? Because we do a lot of research on that, Matthias, is the coordination. What do you think about what's happening in centralized countries? And particularly, Matthias, on the horizontal coordination. I'm struck by by countries where it was the prime minister communicating, other countries where it was some public health institute, the leader communicating. In some places was the Ministry of Health.
Yes.
So we have seen as well a very interesting debate on horizontal coordination. Who is leading, who's governing here, and what works better and worse? What do you think about that?
So
it's a tricky question.
It's a tricky question.
I haven't rehearsed it, Lucy. I can tell you. I'm taking him by surprise.
I try to disentangle this a little bit, Joseph, this little analytical mess you're making. So number one, I think we've seen in many countries that chancellors, prime ministers, presidents, first ministers, took center stage and took leadership. And I think it was the right thing to do in the first place, because there are certain trade-offs between health, education, transport, economy within a cabinet. Only the prime minister can resolve or can mitigate, actually. So that's for the start. And we've seen some great leadership examples in Europe, actually. And you were talking about my country, that was particularly good, I think, especially in the beginning. And some people have even said, look at this. This is health in all policies. But unfortunately, that is the moment where things sometimes got terribly wrong, because in a little bit polemic way, you could argue, in many countries, we have seen all policies in health, because in the end, the Minister of Health or the Secretary of State for Health, they didn't pull the shots, it were the others. And if you look at some of the messes, when it comes to lockdown measures, like opening and closing schools, opening and closing borders, the health minister in many countries was almost absent. And then we have the other little mess, if I may say so, the coordination across the different levels, In the Russian Federation, for example, we have the president plus the mayor of London coordinating this. Excuse me, that's very nice, but where's the health part?
Gentlemen, I want to steer you just a little to say something very quickly about then, building on what you're discussing now, the global governance of health in relation to COVID-19. Now you're talking at country level. Let's move it up a little higher for just a minute or two. What are the challenges and opportunities for these institutions in the future?
Let me take this one, Matthias. I know you know more, but there you are. I'm very excited, Lucy. I'm very excited. There are a number of commissions. Actually, there's an overcrowding of commissions now. Many of them are going to be looking at that. You have the Lancet Commission on the response to COVID, with Jeffrey Sachs at the helm. We have the new commission, actually, by Dr. Tedros, that's looking at the health and economy issues as well post-COVID, with Marina Mazzucato, who's been leading a researcher in a neighbor university of the LSE on these areas. Dr. Tedros as well, our director general of WHO, has had another commission with Ellen Clark, former Prime Minister of New Zealand, on the response to the pandemic. And I like to mention, of course, because I'm in the scientific board, co-chair of the Monti Commission, the Pan-European Commission on Health and Sustainable Development. I mentioned, this is not just a shopping list, Lucy. It's a useful shopping list for our participants today to have a look at those, because I have the impression, I know by seeing some of the results, by being part of one, that a lot of the emphasis is going to be how do we get working together. Listen, it's not an issue of whether, it's when and how fast can we do it. I mean, the virus, we know that for years, but the virus has reminded us that viruses, germs cross boundaries, number one. I know it's very obvious, and we know it, but we haven't done enough on that. We know as well it's not just viruses. Economic crisis cross boundaries, refugees cross boundaries. How well we did on global governance in this prior crisis. Yeah. And now the virus has reminded us again that we have to strengthen that. And strengthening that means many, many things. There's now a real strong push towards the role of WHO international health regulations, strengthening those up, increasing some of those on the transparency aspects and so on, and the accountability aspects. At the European Union, we have both the WHO and the European, in Europe, I mean, we have both the WHO Regional Office and the European Union working very closely together. Van der Leyen came up with this, how do we strengthen European Centre for Disease Control, from going from risk assessment to risk management. Yeah. The role of EMA, for instance, We've seen as well global governance on purchasing, for instance, the joint procurement. I know there's been a lot of criticism towards the European Union and the joint procurement of vaccines and so on, but for us, SIM is a really leap forward in terms of access to new treatments, in terms of value for money, in having 300 million people purchasing together. So basically, we see developments in global governance. We're going to see those. We're going to see that it's not an option, but a must, that countries have to come together. Listen, somehow the virus is a disaster, but it's a disaster waiting to happen. Look at the other one who's waiting to happen, antimicrobial resistance. Antimicrobial resistance is a matter also like the virus of One Health. We know it's all about the environment, it's about animal health and human health together. Yeah. So on AMR, we make some progress, but if we don't work together, if we don't regulate antibiotics together, if we don't agree together globally, whether we give antibiotics to our cows and chicken, and we regulate that,
yeah, exactly.
We need those governance arrangements. Sorry, don't you agree, Matthias?
I do agree, but at the same time, while there is a drive towards more coordination, I also see that there's a drive towards more conflict. And talking about the vaccine, actually, there's a lot of conflict around the distribution of the vaccine, but also countries are using the vaccine to gain influence in countries. I think that's also very clear. We have only seen yesterday, actually, that the Italian government, based on EU regulation, has blocked the export of vaccine to Australia, I think it was. And I think there you see that there are concrete conflicts and that there is still vaccine egoism, despite all the acknowledged needs to work together. So I think there are both dynamics at the moment at work, the need of closer collaboration, but also there are drifting apart in terms of spheres of influence.
I mean, we cannot accept, Lucy, some of the knee-jerk reactions we saw at the beginning in this European Union of closing borders and so on, and some of the countries going against Schengen principles. We do need the role of this European Union to coordinate the member states, to have common arrangements, common agreements. Now there's a whole debate about the vaccine passport and so on. I'm not going to take a position on that. Maybe Matthias, you want to do that? It's a hot one.
Before you move on.
But why don't we get, Lucy, the views of the participants? By now, I hope they warm up. Exactly. And they're very happy about what we say. So let's have some debate.
Exactly. In fact, I wanted to put to you a question that came from one of the participants. This is Monica Dasgupta, who says, what is the likelihood of improving national and international governance of health systems before the next pandemic, which could take place within a decade? And I'm glad you brought in the issue of antimicrobial resistance, because who knows what the next one is. So what's your take on that? Maybe just respond to Monica, who's listening now, Josep.
No, I think I was saying that earlier. Is it wishful thinking? Monica, you may think it's wishful thinking. I think the likelihood is very, very high this time.
Yeah.
What's happening now, the point I'm trying to make, which is not rocket science, and I'm sorry you were wasting your time hearing things you knew already, but a lot of what the pandemic is telling us, please, it was there. We saw it in this continent and elsewhere with the financial crisis. We saw it with the refugee crisis. We've seen it. We have the same populations, the vulnerable, suffering the most. We see the same knee-jerk reactions of some of the member states not cooperating with the others. We are in a globalizing world, not only because of the viruses, but because of the economy. So either we play together or we go down together. So I think now the key actors, the IMF, the financial actors, those who in health we want to convince, are paying attention to that, and they realize that either they play of that, otherwise this is about global security, this is about social sustainability, it's about financial sustainability. For the love of God, we're talking about what, 10 trillion? What is that 10 trillion? It must be what, two-thirds of the EU budget, the GDP?
Yeah, that's true.
I mean, it's just either we go and make those changes, or the cost of the next one, the AMR, or many others we don't know, is going to be disastrous.
Yeah.
Wow.
Don't you think?
I do agree, but as it is with solidarity, I think it will also be with governments that the changes and the effectiveness of governance in the future will differ a lot. So with the solidarity, I think the strongest solidarity is still the nation state. Then we have the EU, and then we go to the global, and it's a little bit leftover solidarity. It's better what we had before, so that's really great, but it's still not the same. And I think with the governance, we will see a lot of improvement on the EU level, but you know, that's not so difficult because the governance was not so good actually, and member states always hesitated to mandate more powers to the European level with regards to health and health systems. But I think this is changing at the moment, so we will have the strongest impact there. But also inside countries, you know, I think that many countries acknowledge we still don't have the data infrastructure. We have neglected and underfunded our public health services. We have actually circumvented our existing emergency units, our existing emergency structures. You know, we need something else. Our policies were totally useless, and we had to change them twice and so on. And I think there will be a lot of learning. And again, and I think that's true what Joseph says. At a certain point in the pandemic, in many countries, my impression was money doesn't play a role. They were throwing at it because the economic consequences are so huge, you know, that you say, I don't care whether we pay 18 euros per doses vaccine or 36. It doesn't make a difference in terms of what we are losing at the moment. So I think I'm in good hope. As I say, I think we will have more in the EU level, some in national level, and I cross fingers that internationally things will improve, but I'm not 100% sure.
Thank you, Matthias. You brought in the issue of financing, which I was going to ask about a little later. So if I can just get you to comment briefly on communication now. Specific country success stories are usually accompanied by very high levels of public trust in government. What have we learned about the importance of timely communication at national and global levels? Joseph?
Can I take this one? Because he's our communicator in the observatory, so there you are. So that way we disagree a bit.
Yeah.
I mean, there were, actually I cheated earlier. Actually, he voted, but my real vote would have been communication. So I had two lessons, remember, humility and humility. And then the next two lessons would have been communication and communication. Mm-hmm. I think we had lots of important lessons about trust, transparency, and timeliness, as you already, we on the observatory talk about the 3 T's actually of communication. We have lots of lessons because, as I said earlier, mm-hmm. you know, transparency is no longer something that you spin, is no longer something that is a luxury. It's a matter of survival for politicians and scientists to present this transparency. Mm-hmm. So, what have we learned? I wish we had time, and I hope you guys come to the work of the observatory where we've been looking at, in our COVID monitor, we've been looking at the strategies country by country. We're publishing a lot about exact details of how countries are doing to communicate, what kinds of mechanisms they're using, who are the communicators. But what would be the kinds of lessons? The first lesson is, we all learn that in moments of crisis, mm-hmm. science, policy and politics becomes one. You no longer can differentiate it. In my world of communication on researchers, Matthias is a good researcher here, is you do the science, mm-hmm. you then develop the policy, right? Mm-hmm. Linearly, and then there's the political value trade-offs and consequences. In practice, in crisis, it all comes together in one single bundle. Mm-hmm. On the science side, first of all, we have seen lots of evidence uncertainty. So how do we deal with this evidence uncertainty? I mean, let's face it, for instance, now, Matthias, is it based on evidence what we're doing between us? Actually, we should tell you that because we want to be in the same room, we both took a rapid test, okay? So we are okay. At least we're not contaminating each other today. But do you know the amount of research that scientists have input into, is it 1.5 meters? Is it 2 meters? Is it 3 meters? Mm-hmm. This is your precautionary principle, my friend. I know. Do you know the amount of confusion about, is it 1.5 meters? Is that making a difference? Should we wear a mask or not? Have you seen the variability mm-hmm. between member states about wearing a mask? what is the reaction of our constituents, those who vote for the politicians, you know? Well, they really don't pay attention. This is the source of infodemics. So pragmatism is important. Precautionary principle, there you are, we agree here, is extremely important in terms of communication. Look, if you want to have fun, look at the Spanish flu of 1918. Guess what were the messages with not much evidence at that time? Wear a mask, wash your hands, close churches and schools. Yeah. Took us a long time to make those decisions. Exactly. It was in 1918. Yeah. So that precautionary principle, I think, is a beautiful example of a precautionary principle, actually. But I like to extend a lot because on that one, because I think it's a lot of fun. So what other, we talked a lot about that, but be aware of the political trade-offs that are necessary. Don't be arrogant as a scientist communicating. We had all these scientists communicating single-handed, which had their own cognitive biases. They had their own political values as well that they didn't express. And our politicians are responsible and accountable for that to do political trade-offs. There are issues about education and closing schools. There are issues about the economy. They are real. These policymakers, they are voted by the Dutch and they believe in individual freedom. They voted by the British that believe, some of them, about they're against a nanny state. These are reflecting all these views. So how do we get those trade-offs transparent? And this is where politicians have learned, the good politicians have learned to say, these are my trade-offs and they're transparent. Actually, the Swedish, although didn't work very well, don't you agree? One thing they were very good, didn't work very well in terms of if you look at the numbers now, one thing they were very good at was communicating the uncertainty and the trade-offs and the values quite well, acknowledging that the Swedes themselves believe very much in this individual freedom. Don't you think?
I think what we've seen is that countries have kind of opinion corridors, you know, things you can communicate, go through this corridor, but outside it's not possible. And in Sweden, I think they have these particular values of self-reliance and responsibility, and we don't overreact, and we can handle this, and which is different in other countries. And I think that the UK and the US also have quite different value sets, you know, which make it much easier to communicate some of the opinions and views than others. Yeah. But having said this, I should say we shouldn't give in to this, because we had in the past kind of opinion corridors which prevented us, for example, from doing health promotion and prevention, you know, fighting tobacco. Oh, it's a private choice, you know, tobacco smoking, alcohol, highly processed foods and all this. I think it's understandable that there are cultural contexts and that countries need to take this into account and communicate. But cultural context does not necessarily mean it's good for the people, actually. So,
Matthias, I'll just.
But there are ways, Lucy. There are ways to good practices there.
Yeah.
In terms of coordinating the communication, having one single source, we can illustrate that. In terms of agreeing the messages, in terms of political parties playing a very sort of supportive role in those decisions, not only playing politics on the communication, different political parties, different levels of government. So there's plenty of good practice on communication, and lack of good communication has been a total disaster for some of our member states.
Yeah, thank you both. And actually, just building on what Matthias was saying about cultural, you know, the importance of cultural context here, just to mention that beyond the European Union and beyond America and beyond the regions where the WHO 6 official languages are used, in Africa, we have multiple languages. And therefore, there has been challenges with passing on accurate COVID-19 related messages. I mean, this is an issue that was highlighted as a challenge with the Ebola response too. You know, people who, the first responders from the West could not speak the local language, and that significantly hampered the response efforts. So meaning is often lost in translation beyond the wider, whatever the government wants to communicate. If in some settings, like the Africa settings I'm talking about, if they don't synthesize this, if they don't translate this to local languages, then you don't get it. And sometimes, unfortunately, pandemics like COVID-19, or maybe fortunately, they come with new jargon. There's social distancing, there's a mask. which have no translation in local languages. There's no word for mask in my local language. And the word for social distancing in my local language almost means me just trying to stay away from everyone else. But that's not really what we want to communicate. And when that, in a cultural context, then telling me to not to visit my parents, not because we don't have a word for social distance, then that is not acceptable. And that could easily hamper any kind of pandemic communication. I just want you to take on two questions from the audience. There's Anna is here who says, were the IHR 2005 followed in light of the COVID-19? And what role did communication play in this? And the second one, I'll just give you both. The second one from Juan says, why has there been so little policy learning and transfer in COVID-19? Could new forms of communication improve this? And with your role at the observatory as knowledge brokers, I'm sure you have a lot to say on this one.
I take the second?
I take the second.
I take the second.
Which one was the first?
The first one was whether the IHR 2005 were followed in light of COVID-19?
With follow-up?
IHR, International Health Regulations.
Yes, yes.
International Health Regulations, 2000.
Yeah, okay.
Yeah.
I think
Go ahead.
the question was whether they will change, whether there will be follow-up. I think this is actually underway at the moment. I'm not an expert on it, but the two elements I know which are highly debated is number one, that WHO has more powers to go to countries and request information, which was one of the criticisms we received. And the other one is that the International Health Regulation, but please correct me if I'm wrong, Joseph, seem to have underestimated a little bit the relevance of travel in certain times of the pandemic. So the International Health Regulation tried to keep borders open as long as possible. But if you, for example, as a policymaker have an exclusion strategy, you want to exclude the virus from entering, like, for example, some Pacific islands have done, you know, or if you say we have an elimination strategy, you know, to really get it out of the country, there might be good reasons for closing the borders for a limited period of time. Joseph.
No doubt to our question, we will see those strongly strengthened. This is coming out now very soon by part of one of these commissions I mentioned by Ellen Clark, led by Ellen Clark, former Prime Minister of New Zealand. And one of the areas that they're looking in a lot of depth is the international health regulations, how to enforce them further, how to expand them further in areas of transparency, of speed of information, and so on. I think that's it's clearly one of those global public goods element. A lot of debate these days, we're talking about governance, is discussing about the global public goods, and certain international health regulations are now at the core of all the debate. Yes, we predict, we're sure that there's going to be a bonanza for international health regulations, and we hope very much, and we trust, and we believe that with the role of WHO in playing that role, I think the role of WHO is getting massively strengthened now out of this debate. You want to go in communication and follow? New communication approaches? The communication approaches, yeah. New communication.
No, communication is fine.
All right.
The second question was the little policy learning, you know, and I'm not quite sure if this is true. The problem is countries are very forgetful, you know. Take, for example, Germany and Belgium. Germany was very good fending off the first wave of the pandemic, but then they forgot about it and they got back to normal politics, and they invited the virus back in. And Belgium had severe difficulties with the first wave, but then managed to get out of it and then let go, and they forgot about it. So again, too late, starting with measures, not strong enough the measures. So at one point in time, they do the right thing, and then later on, they do the wrong thing. And I think this is still because, of course, there are politics around. There's always somewhere an election, especially in federal countries. But there's also, you're looking so stern at me, you know. There's always an election around. But there's also hope, you know. oh no, we gotta pull out of this. It won't be so bad, you know. We are now doing the hammer and the dance. The hammer has come, and now we dance away the next waves, you know. And I think that in some countries, and again, we're coming back to the leadership thing, you know, if the leader is really saying it's not that easy, we need to keep our guards on, you know, we need to be very vigilant, and slightest changes in the monitoring of in the metrics, you know, we need to react again, and communicating this, even though this is not very popular. I think that is key, and it has not worked in many countries. And so I think what you said, Joseph, earlier, the humility, but also being precautionary all the time, you know, and really reacting to changes in the epidemiology, that is key for such a pandemic.
With hindsight as well, I think the debate now, is the COVID-19 suppression, which is now sort of the big debate these days, would have been, in hindsight, what we should have done. Actually, before summer, we had a great opportunity to go for much more radical measures, which would have probably managed to stop the pandemic. I think there we probably got it wrong, because, as you said, we played the dance and hammer sort of game or curve, which hasn't quite worked. Also because we haven't quite coordinated that, and we still have open borders. So
we are still talking about lockdowns and meaning completely different things, actually, you know, starting it at different points in time, ending at different points in time, but also including different measures and implementing the measures in different ways, you know. And I think that is also an issue that sometimes, you know, as I said, we play this all policies in health game, and then we can go to the hairdressers, but we cannot go to this or that shop, and it doesn't make a lot of sense. And in certain points in time in this pandemic, it really requires to be very, very serious.
Yeah, well, we all seem to be learning on the feet, just learning, working with science, but also just, again, like you said, some political decisions, health decisions, and just these two mixing in many ways. But I want to ask about financing now, and this is a huge one. So the notion that more health is equals to better health has been challenged by COVID-19. We all agree to that. And what have we learned from both ends of the spectrum? You know, wealthy nations with more established public health systems and less wealthy nations with less established health systems.
Should I take one?
Yeah, you should.
This is one that indeed I think let me echo your first point, that more wealth hasn't been more health in this particular case.
Yeah.
And it's fascinating how the Global Security Index for pandemic preparedness, actually we had the data for 2019, was actually quite related to the economy. And the wealth, and actually we almost see in some when you look at the distribution, was almost a negative correlation in which wealth clearly hasn't played the central role. I think there are many elements that there are many. It's a fascinating area. There are many lessons. Well, perhaps the one that it's been very important is that actually I go back to governance, to you, Matthias, which is it's not as much only about the health system, but the political and economic and social context. It's been a lot about culture. It's been a lot about civil society. We almost go back. We are very repetitive today. I'm sorry. To the governance and to the communication. COVID has responded, of course, to the health system and the capacity, but a lot of that has been the response of civil society, the response of the way that we communicated sort of a number of preventive measures. That's number one. Number two, I don't know if it's wishful thinking, but we've been doing some research on that, and it seems that clearly countries with universal health coverage, more or less rich, but universal health coverage having a good integrated system, avoiding fragmentation. Vietnam is a good example of not a very good, very sort of rich country, or even Thailand, although Thailand has some fragmentation still. Countries in which they're not necessarily rich, but they manage the universal access very well, they manage the integration very well. So I think COVID has reminded us it's not just about the amount of money, but it's about the universal coverage, is about the governance, is about the ability to integrate, the ability to deal with the fragmentation. I think that's been fundamental on the success of wrestling with the pandemic. But would you agree with that, Matthias?
Yeah, I would agree with that. And you know, I mean, let's make two things more clear. One is, you know, we're now talking about rewarding actually nurses. We were all clapping hands, and now in some countries, nurses getting quite disappointing offers for new pay packages. And actually, that is a profession where we need to invest in. I think that the COVID pandemic only and the crisis has only brought to light underlying issues we had over years and years. We have a lot of attrition, we have a lot of turnover in nurses, we have a lot of dissatisfaction with the job, and we are losing many nurses, you know, prematurely actually doing something else. And this, I think, the COVID-19 crisis, where everybody has seen how important this profession actually is, how vital this profession is, you know, would have been the opportunity to invest this. And I think that is important. And that's part of the finance, but also part of the civil society, because we are talking here about professional associations and negotiating with this. And the other thing, which I think is very important, but probably when we come to the innovation, we'll talk about it, it's procurement, financing innovations. I mean, I think that we really need to change our system of purchasing, commissioning, procurement in times of crisis, and maybe also in normal crisis, because the way we are doing it at the moment, and that is true across the board, has led to intransparencies and sometimes to inaccountabilities, actually, to an extent which is really problematic. And one of the milder cases, and really it's one of the milder cases, are the contracts between the Commission and AstraZeneca and the Commission and the UK and AstraZeneca. In the end, they have at least published retracted versions, but still, you know, from Latvia to Portugal, you know, we have still fishy things going on, and a lot of law cases.
Going back, Lucy, on your question on your point there is impeccable as always, Matthias. Let me echo it further. Hasn't been the amount of money, but the flexibility and the ability to contract and allocate. We've seen that in our research, right, Matthias? The ability to pay, for instance, for some innovation, the ability to reward human resources, the ability to pay hospitals to deal with the additional investments of COVID. The ability to contract, the fast on your feet to put money into primary care and access, that's been as important as the amounts of money. So it's quite interesting there. So the allocative efficiency elements, the having allocative efficiency in terms of sort of, I don't want to fall into jargon, in terms of your ability to allocate those resources to those bottlenecks, it's been fundamental as much as the amount of money. Sorry, we should get the audience speaking.
Yes, I want to put in a question from the audience, but also just was saying that I echo what you're saying. It's about the mix of how we allocate what we already have. But in many other settings where that basket is not yet enough, for example, in many sub-Saharan countries where there was limited fiscal space to expand in that limited period, what we saw is that the private sector actually came in a big way. In the private sector here, I mean all non-state actors, individuals, corporations, and just the large stock of resources held by the private sector and their potential to come in and contribute to a pandemic response. So just pulling private resources for public good. And so they have stepped in Africa, for example, to support national and regional bodies, which has been very commendable. In some regions, this has built on lessons learned from Ebola previously. For example, we had the Ebola private sector mobilization group, and there's lessons from that. And I think ongoing, just for Africa, ongoing, I think the challenge will be then how, if we are thinking about all hands on deck for UHC, how then do we create the proper regulatory environment, or the proper environment where or everyone can come in, and it's civil society, it's just everyone who's not the state in this case. But there's a question from the audience here. Dechen asks, which should come first? Is it the economy or health during such tough times? And where do we draw the line considering issues such as double trap? Josep, that's yours first, or Matthias?
Thank you. That's kind of you.
Can I go first?
Okay.
I think it's a wrong dichotomy. And I make a concrete example. We had last week a webinar on long COVID.
Yeah.
And we still don't know about the prevalence, but we seem to know now is actually that also people which have had a mild COVID, not being hospitalized, suffer from long COVID.
Yeah.
And we had 4 speakers, and 2 of them having long COVID, and they are our age, younger than us actually, much younger, and they have it for weeks and months. And if they are unhealthy for weeks and months, they are lost actually for the economy. And I think that the simple thing is it either health or is it the economy? I think we need to see the linkages and how health and the economy are reinforcing each other. The idea that we can all get the virus and open the economy and then we will be rich and in 2 years' time we are dead and healthy, it's not working, and you were mentioning actually this old evidence from the Spanish flu in the US, which has exactly shown this as well, actually. So
I'm unhappy, Matthias.
Please.
I'm unhappy because you stole my thunder.
Not because of me.
You stole my thunder. I couldn't agree more. It's been a false dichotomy. I remember a blog who was talking about save grandma or save the economy. And I think you can, actually by saving grandma, you're saving the economy. I think this has been highly manipulated. There are still trade-offs, so Matthias.
Yes,
there is we still need
saving
to consider
$1 billion pounds because so many pensioners have died.
Wow, that's
terrible.
That's terrible. That
we was reported in the newspaper.
We don't want to go there. But the work of the Observatory on the Economies of Healthy Aging, we're actually been demonstrating that healthy aging, it's very, very good for the economy because the role that aging plays in society in terms of cohesion, in terms of sustainability, in terms of the informal work that our grandmas are doing, that they are not measured in the economy, is very important, Lucy. A lot of one of the pillars of work of the Observatory is called the Economies of Healthy Aging, where we've been demonstrating actually that it's not true that getting our grandmas dying, we're saving money. We may not save money for the pension, and I know you're making it as a joke, obviously, but actually when you look at the numbers and you look at their contribution in terms of cohesion, in terms of informal work, taking care, it's usually grandma who takes care of granddad.
Yeah.
Often. If your grandma is not around, granddad has to go into long-term care, which is very expensive for our economies. So we need to really nuance that far more than has been said by some economic actors. But there you are. Now we're going to agree. I agreed with your answer.
Thank you. At least we've come back. We know there's some agreement at the end. You're in the same room, so it's important that you agree on issues. Finally, and I think just 1 minute for each of you because we're running out of time. What, in your opinion, are the greatest innovations the COVID-19 crisis has catalyzed, and how sustainable are they? So I'll just do 1 minute from each of you, then I'll just share something from the audience so as we wrap up. Please. So
I hope I'm not misunderstood as cynical, but I think that COVID-19 and the health system's responses to COVID-19 have really been a bonanza for innovation and implementing innovations. And I'm just mentioning 4. Number 1 is the possibility of having Corona apps in countries which always had privacy issues, which were against health records, electronic health records, which for the first time had this sort of device, even though it didn't work very well. Actually, it didn't make a great contribution to testing and tracing, but that was important. Second is we have seen in most countries the introduction of teleconsultation, which was a no-go in many countries where the medical associations were against it. And now we have legislation for it. We have a change of scope of practice. We have financing instruments for it. That's great. The health workforce, we have seen, especially in the hospital sector, an extremely agile health workforce adopting new roles, new tasks, moving from ward to ward. And the final thing I would like to mention is that It was already on its way, but it's becoming now much clearer that we are moving towards new public-private partnership in the development and production of vaccines, medicines, tests, but also new public-public partnership. And we all say that the quick development of these vaccines is a real almost a miracle, but it's not a miracle because it's part of the support of government infrastructure, government monies, and government safeguards. So that's just an overview that I think that's really worthwhile digging into to retain some of this, of course.
Thank you, Matthias. Thank you.
And I will agree with him. There you are. Today we're going to agree, but let me add some more elements. I mean, absolutely, Matthias. And we were looking the other day, you were running a webinar on Israel and the success in vaccines. The success in vaccination in Israel is partially due as well to their big data, to health records. And so we see clearly those countries we had that had these innovations in place, or they stepped them up, they had a much better success in doing that. We see organizationally that the mistake, Lucy, is always think about innovation, not gadget innovation, technology innovation. But as you're saying, organizational innovation. Yeah. The skill mix, the way we got professionals working together, the way we got integrated and networks of hospitals, primary care working together, that's fascinating. So it's really interesting, Lucy, and we like our audience, our researchers to work on it, is the innovation in the introduction of innovation. So a lot of these innovations were there. Yeah. It's not rocket science. How long have we been talking about big data, about e-health records, about telemedicine? Since I'm aware of myself, I'm kind of an older man. Yeah. So why is it that in 2 weeks, we got countries introducing telemedicine and the purchasers jumped every single loop to get doctors and hospitals paid for that? Yeah. How do we harness that energy, that capacity, that disruption? Yes. How do we maintain that? What happened there? And how we reproduce that? Of course, we shouldn't reproduce it by having a pandemic. Yeah. But let's look at the processes. Let's look at innovation in the introduction of innovation. That's what really should interest us, because it is the process and the innovation, the organizational innovation, how that was introduced, that really we should be studying it and trying to reproduce it, hopefully without having another pandemic, of course, not under duress.
Exactly. Thank you. Thank you very, very much for your input today. I'll just say that as Dr. Moeti, the WHO, our regional director for Africa, says, recovering from this pandemic will be totally incomplete if we don't have strong measures to bolster health systems. So she says we must seize this opportunity. This is an opportunity and make the leap for a better tomorrow. So thank you very much. Just one comment here from the audience. They say that 2 other priorities to add to our list would be equitable access to the health system and the fallout, the potential fallout of the crisis, with mental health. And I think this is food for thought for all of us. So thank you for everyone. I will just hand over to Justin to wrap us up because I think we're out of time. But thank you very much, and thank you to our audience.
Well, great. Thank you again to everybody. That was probably one of the easiest chairing jobs I've ever been asked to take on. Lucy, you did a fantastic moderating job, presenting the questions, feeding back some of the questions from the audience. I see we have, there were close to 200 people at one point. And so I think it's a shame we couldn't get to everybody's question, but everyone seemed to be really engaged, and it was wonderful you can answer so many. So it's really been a great pleasure to have the opportunity for me, and I hope for everyone else, to listen to Lucy, Josep, and Matthias tonight. So thank you for taking part. We're really grateful that you could find time in your busy schedule to join us today. For everybody out there, we hope you can check out the rest of the LSE Festival program. We've got an amazing series of live and pre-recorded events that are taking place up until tomorrow, Saturday, the 6th of March. And lastly, it's just very important for me to give thanks to the LSE events and the Department of Health Policy Communications teams for really organizing and helping to run this event tonight. So ultimately, it's just left for me to say from all of us at the LSE, please stay safe, and we hope to see you at one of our events again soon, be it virtually or hopefully in person in the not too distant future. So thank you.
Thank you.